Welcome, everyone. In today's webinar, we'll be discussing GRM's offerings that address the challenges of the administrative or clerical side of HIM operations for both ambulatory and acute care facilities. Please feel free to type questions that you may have into the aptly named questions section of the webinar control panel, and we'll cover all questions towards the end of the hour. My name is Jim Leonard. I lead the healthcare practice within GRM, and I'll be your host for the next hour. With me is Dan Zaccardi, our Senior Sales Director for GRM in the Northeast, and Dr. Sonia Bruton, the CEO and President of CCI Health and Wellness of Maryland. Dr. Bruton will discuss her real-world examples of the benefits of the offerings we'll be discussing today. The CCI Health and Wellness Services is an FQHC with 6 locations in Montgomery and Prince George counties in Maryland. They have 6 facilities with more than 280 employees, and they serve 60,000 patients with more than 80,000 visits in the year 2020. GRM is a leading document and information management company with operations in 15 US cities, as well as operations in South America, Europe, and Asia. Healthcare is by far our largest market, and we serve thousands of clients. Here's just a small sampling of our healthcare client base, and we have clients from the largest for-profit organization in the United States, all the way down to single physician practices across the country. All of the offerings we'll be discussing today leverage our cloud-based technology platform, which we call Visual Vault, a software as a service solution recognized by the largest technology evaluation organizations in the US. And I'll highlight just a few of the important aspects of this platform. Our intelligent forms capability is widely used in all of our offerings, and particularly in the solutions we'll discuss today. Intelligent forms are the primary user interface for all of our systems and how we present information to users and allow them to augment that existing data within the platform. Every solution that we offer clients heavily rely on our workflow automation processes, which allow clients to take their manual work processes and automate them within the platform, making these work processes inherently more stable, accurate, and capable while providing visibility and accountability across the organization. GRM's automation suite of products addresses many of the current challenges associated with HIM administrative operations. Over the past 24 months, several unique issues have resulted in challenging HIM environment we're dealing with today. COVID-19 has caused many administrative staff to seek employment opportunities outside of healthcare, particularly in the ambulatory environment. The recent upswing in hourly wages associated with businesses such as Amazon and even Walmart have also caused administrative or clerical staff to leave for assumed greener pastures elsewhere. This has put pressure on clinical staff in the organizations to also manage these administrative tasks, which does nothing for their job satisfaction. And now I'll turn it over to Dan and Dr. Bruton to go into more detail on how these issues were addressed at CCI.
Great. Well, thank you, Jim, and appreciate everyone's time. Thanks for joining us today. So really the first component of our HIM automation suite we want to get into is where Dr. Bruton and I first engaged about 4 years ago now. Which is our medical record release of information solution. And Just before I bring Dr. Bruton into the conversation here, just to give everybody a little bit of an overview of the solution and what we're solving here is, everybody here who's familiar with release of information knows that it's a process that's very manual. It's there'll always be some manual components in this process, and the main goal of the GRM ROI solution is to automate and streamline as much of the activity as possible to make the process easier and simpler for both the requesters and for the health center who needs to deliver these records, all while keeping it obviously secure and HIPAA compliant. So GRM utilizes a combination of I-forms and workflow, as well as skilled labor on our end, to provide a complete end-to-end HIPAA compliant release of information solution that completely takes the ROI burden off of our customers' plate. The solution at a very high level, I'll run through it quickly. GRM is actually the point of receipt of these record requests. In order to do this, we create a broad funnel to capture as many of these release requests as early in the process as possible. So that means that could be through fax rerouting or being added to our customers' phone trees, so we receive phone calls. Also, we typically add a secure I-form to our customers' website, so these releases can be filled out digitally and signed digitally right through the website in a secure fashion. We even have ways of ingesting paper authorization forms right from the requester. So GRM, from that point, has an extensive authentication process to ensure that requester should in fact have access to the requested records. They pull the requested information directly from the EHR system, redact information when necessary for certain types of releases, invoice and collect payment from the requester, and then securely deliver the requested information to that requester. So it's a full end-to-end solution. We take over 100% of that process. And with that, I want to bring in Dr. Bruton, because this is really the conversation that her and I started having back in 2017, and they were faced with a real procedural and process issue at CCI with how they were fulfilling release of information requests. So I'll kind of send it over to you, Dr. Bruton. Maybe you can kind of go back 4 years or so when we first started talking and kind of talk about some of those issues you were faced with.
Happy to do so, Dan, and thank you, Jim. And I have to start by saying you're taking me back to times that weren't so great, but I can revisit them because times are better now. So when I started engaging with GRM, we had the release of information function added on to first our floater medical assistants. So we have at each practice a couple of medical assistants that are assigned and rotate through to do some of the clerical or admin work or phone calls or things that are not direct patient care. So that was the primary responsibility of the floater medical assistant, with backup offered by the site managers if the floater had to be pulled, as happens in many of our organizations because a staff member was out and they needed to cover for them, or things got extra busy and more clinical hands were necessary. So that is who did the bulk of the release of information fulfillment. And then we had the category of release of information requests that came through subpoena. And those were actually done by our senior leadership team because we didn't trust the discretion and the execution on the ground. So what we had was a group of workers for whom this was one piece of their work. And yet in our organization, especially as it continued to grow, and the numbers that you heard at the beginning of the broadcast were our 2020 numbers, which were pretty similar to where they had been 4 years ago. 2020 was a down year for us due to COVID-19. So that was about our volume, and it was growing. And so on any given day, at any given site, there were multiple and many release of information requests that were being given, either from a patient themselves or from a medical practice that needed it for some referral work that they were doing on our behalf, or maybe the patient was moving and the records needed to follow them. And so what we were dealing with people were people or places that had an urgent need and a workforce for which this was part of their work. And so they would get to it and fulfill satisfactorily that request some of the time, but more often than not, they hadn't gotten around to it. And in our state, as is the case in most states, there's actually a statute of time that goes into effect when somebody requests their release of their information to when you actually have to fulfill it or release it.
Yep.
So that was breaking down for us. We had people that didn't have enough time to get this work done. They didn't have the skill level to do it. They didn't like to do this kind of work. They actually had become medical assistants to work directly with patients. And so there were room for breakdowns all throughout the stream over and over again. And when it came to the senior leaders, there was just a great deal of resentment to be doing this kind of clerical, technical work that you had to pay some attention to because you had to be careful of what you pulled and what you didn't. And these were folks that weren't usually working in the medical record. Mm-hmm. So in comes GRM, and they had an automation or a solution for this. They had a way that this could be done that not only took us out of it, but also took the paper manualness away. We had a situation in our state where you charge by the page. And so you'd have medical assistants going into the records, pulling what was needed or what they thought should be released, printing it, counting the pages, filling out a form that said how many pages that particular packet included, and then packaging it for send out. Well, as you can imagine, on many cases, the medical assistant wouldn't bother. They'd just give it to the patient rather than go through all that. Nobody wanted to have to count the pages, and depending on what the reason for the request was, that page count could be 50 pages before it was all said and done. And then you had the situation where it was really hard for a medical assistant or a front desk person to charge somebody for records that they believed had financial issues and other parts of their lives. And so we had people doing work in a sea of multiple responsibilities, and we weren't getting paid for that work. Their time wasn't being reimbursed. And you might have a site that the person would take the time to count and charge, another site where they didn't. And so patients weren't getting the same treatment. And it was just a problem all the way around. With the automation solution that GRM offered, all of those things were satisfied. I didn't have to wonder, or when a patient complained or would call and say, I'm waiting on this, or you said it was going to be done today, I can look into an electronic system and I can see where it is on the process, all the way down through fulfillment. I can see what they were asking for, if there's a holdup on the fulfillment side or the patient side, where that is. We had an agreed upon timeline at which the release of information would occur. And so I could tell a patient with full integrity and firmly, this is when you'll receive the information, this is how you'll get it. And everybody would leave the transaction satisfied.
That's great that you walked us through that. I appreciate that, Dr. Bruton. So I would say, kind of compounding the issues at the time, and maybe some other health centers are experiencing this, you're giving a medical assistant a task that, one, they're not trained to do, nor do they want to do, nor, as you said, are they very good at it. And they're given this task and it's a burden to them. I would imagine that could lead to, which could compound the issue, to some dissatisfaction with the position they were hired for, which could eventually lead to staff turnover, and then you're bringing in somebody new who needs to be trained on the process. So it's kind of a snowballing issue. Is that correct?
It was becoming a cycle of it did kind of sow those seeds of discontent, and it did kind of feel a little bit like a bait and switch. Like, I thought I was coming to work with patients, and then for us, I don't know how it is in other practices, what we find is, especially in our medical assistant workforce, they didn't like the parts of school that were sitting and looking meticulous at written information and having to fill out a lot of things manually. They actually liked the profession of medical assisting, partly because they could serve, but also because it played to their strengths of actually doing rather than sitting and creating and crafting. They like to be busy and moving around all day. They didn't want to be sitting down doing what amounts to a bunch of things from the desktop, and then being accountable for it and having deadlines that are associated with it, you know. And so for us, it was clearly not sustainable, because it wasn't even as though they had the luxury of that being the only thing that they were required to do. It was a complete add-on. It was an add-on to all the other patient care things that they were supposed to be doing. And so I was faced with needing to establish this department and to say, okay, I need to then create this automation division that handles the fulfillment of release of information requests and any other administrative tasks that we might need them to do. What would that look like? What are the issues that come with that work? What's the equipment that would be necessary? How many people would I need to fill 8 hours a day, every day, at every site that this was happening?
Mm-hmm.
And just what would amount to me needing to put forth a full business case and pro forma was not work that I was really interested in doing. I didn't want to get into that business. I didn't want to have to evaluate growing in that way and beginning to manage and select and continue to train that kind of workforce. And so for us, GRM kind of appeared right at the right moment. And for us, it wasn't appearing. It literally was an email that came through my inbox that was asking me if that was a pain point. And I was shaking my head as I was reading and saying, yes, it is. And quickly dialed the number to have the conversation to see if they had a solution to a problem that I needed to solve. And in our situation, the more that we talked, the more that we told what we needed, the more that I learned what they offered, the level of listening and the level of partnering that was being offered. For us, it's an out-of-state relationship. We are based in Maryland. I was talking to Dan at the time, and it was very clear in his speaking that I was talking to a man from Boston. They were not right here beside me. And all of that distance just melted away, because they could do the work as though they were sitting right beside me from wherever they had deployed that work inside of their organization. And Dan, in his talking to me, you heard that his title is sales. And it wasn't like any other sales relationship or conversation I had been in. It was really a partnership conversation and has remained that way throughout the years. And so in many of these situations, the person that sends you the email is not the person you speak with. The person that you speak with is not the person that implements it. The person that implements is not the person that handles any problems. And Dan has remained a continuous factor in our business, starting here and in other things that they offered from the very beginning 4 years ago till today. And he was the name on the initial email.
Well, I appreciate that, Dr. Bruton, and I appreciate you bringing up the word partner, because we view CCI as a partner, and that partnership has kind of led to more conversations or different conversations about other solutions that we offer. But before we move on to clinical document I-filing, I just want to point out something important that you mentioned earlier, was that visibility into the release of information process that I think is super important to senior management at any health center, even though they're not getting their hands dirty in that day-to-day process of fulfilling releases and being able to see or going through the process of, you know, digging in and pulling together those medical records. It's super important that they have that visibility to see what has happened in the past day, the past week, the past month, who's received records, who's requesting records, what audits have been completed. So I'm glad you brought that up, because that's something I left out of my my high-level overview to begin with. And you also brought up, you know, you didn't want to get in the business of hiring an administrative staff to complete this work. And I think that's kind of where our conversations evolved from simply medical record release of information to the next piece of our HIM automation suite, which is our clinical document I-filing solution. And this is one that Dr. Bruton, I mean, you go back 3 years now, I think we started these conversations with, all right, what other process within your HIM world can we help automate and streamline and you know, take the burden away from your staff? And again, we were kind of, it was very similar to the conversation we started with release of information, where your medical assistants were tasked with this administrative staff of, receiving, scanning, and filing away clinical documents into your EHR system, and making sure they were put in the correct spot. And what GRM has, and again, I'll do the 10,000-foot overview of the solution. It's really designed to solve exactly that problem, which 3 years ago CCI was having, and pretty much every other healthcare provider out there is having this same issue. And I would imagine it's even compounded with the staffing restrictions that have happened over the past 18 months due to COVID. Keeping up with the process of dealing with the receipt of clinical documents, whether it's through fax or patient walk-ins or US mail or however they flow into a healthcare provider organization, it is a constant battle that you need to keep up with, and especially to keep your providers happy, to make sure they're viewing a complete record for their patients at the time of seeing that patient. So in the past, the solution for medical centers or healthcare centers was to staff up. If we're growing, our HIM staff, our medical record staff is going to grow with it to keep up with the consistent volume, because again, that never stops. So whether a center is growing through acquisition or simple expansion, they're opening a new center, the solution was always to hire more people. So what GRM came up with is a solution that automates this process. So the solution basically involves GRM receiving documents in bulk on a daily basis, parsing these documents out, and utilizing advanced capture solutions and OCR technology and indexing processes to capture the metadata that is important for the individual document, whether it's patient demographic information and the document type, and then utilizing what is known as robotic process automation, or RPA, to get these documents filed automatically into the EHR, into the patient's chart in a timely manner. This is super cutting edge technology that we've employed at a number of health centers, including at CCI, and I'll bring Dr. Bruton into the conversation in a sec. But this is what is, it's eliminating that reliance on staff to process documents. It's getting rid of the backlogs of documents that are mounting up on people's desks or in their inbox or on the fax machines. Documents are filed away, very important. They're filed away in a timely manner, typically next day, so that providers who are actually serving these patients have access to this information in a timely manner at the time of service when the patient is in front of them. It results in more accurate filing. So documents are getting into the correct spot, into the correct patient's chart. We're reducing or eliminating that element of human error that exists. People make mistakes. So this is doing the same work, just more accurately. So to bring Dr. Bruton back into the fold here, this is the exact conversation we were having back in 2018. Kind of a similar situation where you had your MAs with piles of documents sitting on their desks. And again, they weren't hired to do this work. They're not good at doing this work. They don't want to do this work. So kind of bring us back to that point in the situation you were in with all those documents that needed to be scanned and filed.
Mm-hmm. I think it starts where we stepped off of the last solution, and that was, it was just a bucket of frustration. So you had clinical support staff. It could be a front desk person, which we call patient representatives. It could have been a medical assistant. Any one of them could have been engaged in this particular work, because the entry point of the information could have come directly off of the fax. It could come from a patient who's dropping it off. It could come from a patient who's coming for their first visit. They brought, a little baggie or a book bag almost full of papers that they want to take back with them at the end of that visit. So they're expecting that you're going to process that real time. And so any hands could be deployed to handle it in that moment. And what would happen is it was always an add-on or a never-ending task. When the staff member had a kind of a basket on their desk that people could put filing, things that needed to be scanned, people would then look at the stack and say, and be looking for their piece of paper or their stack to go away, or they'd come and clinicians would ask between patients, well, what about, have we gotten this? They said it was going to be faxed. They said it was faxed over. Have you gotten that into the record yet? And the person is just sitting there looking like, no, do you not see this big stack of stuff here? I haven't gotten to it yet. And then you'd have a person, well, I'm still waiting on mine for a couple of days. And then they'd go to their supervisor. Didn't you say these were going to be in within 24 hours? It's very important that I see this information. And for everybody, every piece of paper was very important for their reason in that moment. And so the poor person tasked with completing this work was just over it by about midday. And as soon as anybody was walking up to them, the eyes were beginning to roll because it was just frustrating, and you could never please anybody ever throughout any given day. And so what we started talking about was, and this really came in part of the site visit that you were doing to validate and check in and making sure that we were running smoothly with some of the other work. You started seeing and asking about other pain points and started just asking questions like, wait a minute, so you're saying that you get it in, even if you get it in electronically, you still end up having to touch it and put it back in. It still has to go to a person. Isn't there a way that that could change? Isn't there a way they can go directly in? Is it, what kind of faxes, what kind of scanners, how are you doing it? And so in asking those questions and opening up the possibility that technology can help us, and technology can help us more completely and cover more people's work than anything else that we might design ourselves in-house. I don't care how many times we rework or rewrite the workflow, it wasn't going to multiply hands. We are very lean here at CCI. We're lean because we need to be, and lean because we can be. People who come on board to work for us work hard and take on many tasks. And so I have to say, our medical assistants weren't complaining. We were just clear as leaders. We were shredding them down to the nub with this stuff that was not only time consuming, but energy draining because it didn't have a lot of high points. It wasn't what they thought they were going to be doing when they were very excited to come work for us. They didn't want to be clerical assistants. They didn't want to be secretaries, electronic or physical. It just wasn't what they went to school for and came to work for us to do. And so some of the things that were very advantageous for us with this relationship was it did cut down on just the sheer pieces of paper, because what we learned kind of the hard way, we were moving from one location to another, and we went to open a drawer of a person that had departed. The desk used to be the desk of someone who no longer worked for CCI. We opened up the bottom drawer, and there was a stack of unscanned, unfiled bits of information. Luckily, when we looked through it, there was nothing critical. There was no patient care violation, or nobody was harmed with that information sitting there. But what it showed me was that what was happening was, to avoid all the things that I just said would happen when the papers were sitting on somebody's desk, they'd stick them in their drawer so nobody knew where they were in the process, and no one could keep bugging them or wondering if it was in or if it was done. If they didn't see it on somebody's desk, they'd assume that it was probably already in the system. And so that was a workaround that workforce had started to do that we didn't even know about until we found this stuff in a drawer. And then we saw quickly how easy that could create problems, that you could forget it was there. You could lose the timeline of when something arrived and when it needed to be into the chart. And so the solution offered by GRM was looking more and more attractive. And again, as we were growing and as we were having more and more duties assigned by these few functions that we have in the organization, it was clear that our options were to create our own workforce and department that we didn't have space for, that I didn't have the budget for, because personnel and the ancillary benefits that come with personnel is our largest expense, like any other business. And then it just adds to the complexity of the business and the leadership skills that have to be brought to bear. And so for us, it was yet again where we had a pretty heavy and pretty intense pain point. We had a problem that had to be solved, that our ability to go on the way that we were going was fastly coming to an end, and GRM was there to offer the solution. In the onboarding of the solution, we had to work together, and that's why I say partner. It's not like I can walk up to the counter and say, GRM, thank you very much. I now buy all of your automation services. I send you the check. Thank you. Bye. Now the work is done. They had to learn our system. They had to learn where the documents needed to go once they entered the EMR, so that we could pull the data that we needed for our reporting mechanisms, as well as patient care team members would have access to the information they needed to provide the care. And so that partnership was very customized and very one-on-one to make sure that we set it up right. And once set up, then it worked automatically in the ways that it needed to work. But there was that onboarding and that setup is really helping them to understand how to teach their system how to track and send and where the information eventually needs to land. And I actually appreciated that customization and that one-on-one, because in the business that we're in, data is money. And data is pulled out of our electronic health record, not only for the business side, but also the patient care side. And so in that situation, this solution, this answer to my problem, attended to all the many masters that I have to please as the CEO of a health organization.
So you brought up an interesting point there, and it kind of goes back to what we were talking about with the release of information pieces. You were kind of faced with this choice of, staffing up or finding a different solution, an automation solution. And obviously you went with the latter. You think about the timing of this in our initial conversation surrounding this solution of 2018. And then you kind of fast forward to today, and you go back to those the staffing issues that Jim brought up initially that have been brought up with COVID-19 and other non-healthcare entities paying their staff so much more today with these staffing shortages out there. It just kind of compounds on the point that you brought up. Can you imagine facing this, as so many health centers are today, with thinking the only solution is to hire more people? Because you think about that, not only are those people getting paid more, so your expenses go up, you're also dealing with the compounding expense of staff turnover. So you hire a great person today, but all of a sudden 6 months from now they leave for another opportunity. So you got to go through the whole process of onboarding somebody new, finding a new person, onboarding them, training them. There's obviously an inherent expense associated with that. And you brought up an interesting point with the space. I mean, so many health centers are trying to maximize their revenue generating space these days. And if you're running lean there, the last thing you want to do is create additional staff space to be able to house a medical records staff to do this work manually. So you brought up some interesting points that I just wanted to drive home there.
So Dan,
yeah, I'll just add to that. I'll be really quick. I'll just add to that. If you look under our hood right now, we have 51 vacancies and 42 active searches. So that means that we've got about 10 of those where people have committed to come on board. Their start date just hasn't arrived yet. So not only do I not have the space to do it, not only do I not have the budget that would allow me to keep expanding that staff as my growth continues to happen and as we continue to be in growth mode and in growth plans, I would have difficulty even finding them. I've already got a bevy of existing critical in the business line that I know and understand and want to be in positions that I'm working to fill. Adding that to the load of my HR team, to the hiring managers, increasing our footprint in terms of type of business and type of skill set that we would have to bring on board to even manage and oversee that division, just quickly became not the best choice in my decisional matrix.
Yep.
If Dr. Bruton, that's exactly the topic I was about to bring up, which is you might want to create that group, but could you even staff it at this point in time? Because we're talking with organizations that have 7, 8, 10, 12 open positions just in clerical positions that they can't get this work done any longer. So that becomes another issue as well.
And then just keeping up with it. When I look at where we were when you started and the number of positions that when this relationship started, the number of positions we brought on board that are new, the number that have turned over, it wasn't effective, it wasn't efficient, and it wasn't sustainable. And so what we have now is a solution that is cost effective, it's efficient, and it's sustainable. As we grow, the existing relationship expands to take on that growth. I don't have to do anything additional. The work volume just increases and it gets handled. Now, if we were going to increase by leaps and bounds, if we're going to open 3 or 4 more sites at the same time, I'd probably need to give you a heads up so that you can begin to prepare for that as we were building that out. But the slow and steady growth that we have had over time, it hasn't even had to be a conversation. We don't have to have, they're not a needy partner. I don't have to have regular check-ins to make sure that we stay aligned and that you can always meet my demand. Your organization already has a size and capacity that is larger than my need, so that as my need expands or contracts, it's able to adjust and satisfy it all along the way.
Mm-hmm. It's important to note that these automated systems can work 7 by 24. So where you might need 6 staff members to handle the volume of work, the system itself being automated, working 7 by 24, that volume of work that's coming in is much more easily absorbed into a system that runs 7 by 24 versus staffing up for folks that are only there during open office hours. So there's an aspect of that involved there too. But I know that you also mentioned that at the end of every month, you get the document from GRM that shows you just the number of documents that were filed, that were dealt with. So you have that visibility into the process that's going on, but also a report to hold GRM accountable for things to make sure that they're done in a timely fashion.
Yeah, Jim, I was going to say when I talked over you just a little bit that, I'm a tough partner. I really am. The dollars that we have really need to do a lot of things, and I take that very seriously. Every dollar that goes out of this organization and not back into it to better serve our community is a dollar that I have to be very careful about how I manage and how I make the decision of where it goes. And so throughout this, the ability to meet the standards that I have for a partner or for the work, because if I were to bring it on staff, then I would have an expectation of how that needs to happen on behalf of the communities that we serve and those people. That's pretty rigorous. And all along the way, that has been met time and time again with my expectations exceeded. And I don't have that happen very often, which is why I'm here telling my story, because in terms of finding a partner to provide the solution to the pain points, I've been very pleased with what I've gotten through the products, through the listening, and through the partnership from GRM.
Terrific.
Well, good.
On now?
Looking at the clock here, I do want to cover the last piece, but you did bring up an interesting point there, and just to kind of summarize that, I mean, technology and specifically our technology and these solutions we're talking about, they're nimble and they're scalable, which makes it, it makes it ideal for a small healthcare organization with, a handful of physicians, all the way up to major hospitals, health systems who are looking to automate some of these processes. So the third component of the GRM HIM automation solution suite is what we call chart retrieval. And really the issues that health centers are faced with that this solution addresses is retrieving medical records from outside providers, from third-party providers. Obviously, this is pretty common in a transfer of care situation or what have you. So getting a hold of these records for any health center, for any medical records staff, or for HIM staffers, it can be time-consuming. It can be extremely tedious. Typically, there's multiple contacts made with this third-party provider, whether it be phone calls, emails, what have you, to finally get them to send over the necessary pieces of information for that patient. And it can be especially stressful if there's a looming appointment that's, you know, a few days away, and the provider is saying, I don't know what this patient's all about. I need this record. I need to be able to have this information in front of me before this patient comes in for our face-to-face meeting. So that medical history is needed by the physician. It can kind of add to the stress of that process. So the GRM chart retrieval solution, it completely removes this burden from that process. Utilizing Visual Vault, which Jim covered at the open there as the backbone. Again, Visual Vault being our content management system here at GRM. The customer, the health center in this situation, they fill out an I-form, an intelligent form, right through Visual Vault, containing, you know, basic patient data, information on the third-party provider that the info needs to be gathered from, and what type of information is needed for this upcoming appointment. Once submitted, a workflow is kicked off internally here at GRM. Our chart retrieval team works those retrieval requests. They work the entire process. They take over all the communication with that third-party provider. They're the point of receipt of the requested information. They alert the customer health center when the information has been received. And kind of bringing this full circle is this works in conjunction with the clinical document I-filing solution that we just covered, because you think about it, GRM is that point of receipt of the record from the third party. If the clinical document I-filing solution is up and running, we simply take that retrieved document or medical chart and put it directly into the customer's EHR system in the correct spot, because we're utilizing the automation service. So all of this back and forth and you know, conversations with the third-party provider, phone calls, leaving voicemails, it's all eliminated because we take over that front-end process, and then we have the ability of receiving that record and filing it away using automation directly into the EHR system in a very timely manner within, we're talking a couple business days typically. So it's the third kind of cog of this. I'll kind of throw it back to Jim here to wrap this up before we open it up to questions.
Thanks, Dan. So we've seen throughout this past 45 minutes how GRM's automation suite provides a number of significant benefits and relieves stress points within the organization caused by the difficulty in performing, you know, largely clerical tasks, primarily due to staffing issues. Okay. We provide the HIM staff and the executive management with significant cost reductions and vastly improved process visibility and accountability. You heard Dr. Bruton talk about that. I can see exactly what's being done in the system and where these things are going. You know, we automate these processes that increases the accuracy and lowers the error rates associated with things like clinical document I-filing. And, you know, the patients benefit from this because their physicians have the most timely information exactly when they need it. It's available to them right in their EHR platform. They don't need to go anywhere else for it. And it's really, you know, getting those external documents that were often backlogged or stacked up on a desk getting them into the EHR as timely as possible. And again, because it's an automated process, that function works 7/24. So you don't have to worry about staffing up as volume increases, simply because, you know, our process takes that over and handles that in an automated function. So at this point in time, I'll open it up for questions. We have a couple that have come in during the time. Bear with me, and I'll read a few of these off. The first one is, how long do these solutions take to implement? Probably the longest of the solutions to implement is the clinical document I-filing. And you heard Dr. Bruton say that we come in, we do an assessment, we watch your current processes, and then tailor our robotic process to mimic that activity and to run that solidly and accurately going forward. So that process is probably the longest of the three services to implement, and that takes between 6 and 8 weeks to get that accomplished. Let's see, we have another question. How do you arrive at the 50% cost reduction number? Well, our tools, our various solutions are in place in lieu of, as Dr. Bruton said, you know, staffing up an entire separate department to be able to perform these functions. And we believe that cost savings is anywhere from, you know, 50 to frankly 80% of the cost it would take to staff up that department to manage that effectively. If in fact, in this day and age, that you could staff that department effectively.
Jim, real quick on that, I just wanted to add, Dr. Bruton's scenario was a bit unique, and we designed solutions based around, you know, her uniqueness there. But what made their issue somewhat unique is that their medical assistants were doing this work. So her choice was create a new department and staff up this department to do this work, which is obviously a large expense. Or you know, outsource and automate these processes. We work with other health centers though that, you know, they have a medical records staff of 6, 10, 15 people, and they're looking to reduce costs right off the bat. They already have that department in place, and they're looking to go leaner. And so we have health centers. I work with one here in the Northeast that they had a medical records staff of 6 full-time employees, and they were able to implement these 3 solutions. And now they're down to 1 who also, you know, is a bit of a floater and kind of does some other tasks throughout. So it's not even 1 FTE down from 6 FTEs. Yes. So the cost savings there, when you factor in the cost of these solutions, was at least 50%, if not more, which is what you said earlier, Jim.
Yep, great point. Great point. It's interesting that Dan just basically answered the next question we had, which is what type of staffing reductions or realignment can a health center expect by implementing these solutions? Well, there you go. Dan just gave you an example of a health center that had 6 HIM staff that now only requires 1 to do these particular functions. So the last question here was regarding the clinical document I-filing solution. How long does it take to get these documents filed away into the EHR? And our target typically is within 2 working days. I would probably say that we're deeply within that target right now for those clients that are using our clinical document I-filing. And in many places, it's a 24-hour turnaround time that those documents are filed into the EHR. And remember, a lot of that reason is our processes work 7/24 for you. So these are systematic robotic processes that are put in place. And once we have those documents in hand, that automation product takes over and works throughout the night if it has to get those documents filed for you. So the timeliness of that document I-filing is very solid. And that is all the questions that we have right now. Dan, Dr. Bruton, any closing statements?
Dr. Bruton, I'll defer to you.
I think the only thing that I will add, based on the questions, in my model, we weren't a department or an organization that had this work being done, and we were looking to have better cost savings and efficiency within it. We were an organization that was poorly doing this function and not having set up a business side or division to handle them. And for us, in terms of the costs, what I could say is, starting with our first one, which was the release of information, the model for payment did not involve a lot coming out from us in the beginning. A lot of the work, or a lot of the payment, comes in the execution of the work. So they would do the billing and they would keep those receipts. And for us, that was not a big giveaway, because we were not regularly billing and we were not tracking those receipts. And so it was a situation where what we were paying in salary was never being lined up against the little bit we were actually collecting from getting the work done. And so what I pay or invest for that work, for the automation system that GRM offers to get it done, I couldn't hire a person for that. Like there's no way. It's the corollary is so off that those percentages may sound extreme, and I had never heard those percentages and hadn't seen that in GRM's material. But as I'm sitting here and calculating it for me, that they're met, and probably are a little bit conservative. There's the amount. It is a non-negotiable conversation for anyone to talk to me about ending this relationship. It's not even a conversation starter. The value added and the return on investment is that high for us.
Okay, thank you. We do have another question that came in. Does this integrate with all electronic health records? You heard Dr. Bruton talk about the clinical document I-filing, and that we come in, we do an assessment, we understand how your current process works. We actually do a recording of your staff members doing that I-filing, that clinical document filing into the EHR in and of itself. So yes, we integrate with any electronic health record to do this. We understand what your document types are. We make sure that our indexing process captures those document types appropriately, captures the patient demographics appropriately, name, date of birth, date of service, so on and so forth. And then we map out the robotic process to perform the functions within your electronic health record as if it was a human being doing that activity. So yes, we are completely comfortable that we could integrate with any EHR product out there.
And I will just say that in the course of this relationship, CCI has changed EMR. So we had an EMR change this year, and it hasn't interrupted business.
Great, thank you.
Good point. And I would say we have the ability to integrate with every EHR, and we also have experience with most of the EHRs out there. I mean, we've been around for a long time now, and we've done various projects, whether it's these HIM automation solutions or other projects where we're getting our hooks into these EHR systems. So we've seen them all out there, and we have experience working within these systems.
That's right, great point, Dan. Well, that's about all the time we have. I appreciate everyone's attendance, and I hope you felt that the hour was worth your time. Dr. Bruton, thank you so much for your time. I know you've probably got work stacking up on your desk, having given us this hour. And Dan, thank you again for your time as well.
Thank you all. Thank you, Dr. Bruton.
Thank you.
Thanks, Jim. Appreciate it.